It's normal to cough when something tickles your throat, or a piece of food goes down the wrong pipe. After all, coughing is your body's way of clearing your throat and airways of mucus, fluids, irritants, or microbes. A dry cough, or a cough that doesn't help to expel any of these, is less common. A dry cough can be irritating. But it could also be a sign of something more serious, such as chronic lung disease. If you've got a persistent dry cough, here are a few reasons why you should get it checked out by a doctor. A cough can signal a number of things happening in your body, especially if it doesn't go away. In fact, a cough is the most common reason people visit their primary care physicians, according to Cleveland Clinic. Chronic cough, a cough that lasts more than 8 weeks, may seem worrisome. But it can actually be quite common and may be caused by diseases such as asthma, bronchitis, gastroesophageal reflux disease, and postnasal drip. If you currently smoke cigarettes, or used to smoke, you have an increased risk of developing a chronic dry cough, according to the American Lung Association. Given the long list of reasons that can cause a dry cough, it's safe to say that it alone isn't enough to diagnose a larger problem. Your doctor will most likely need to do further evaluation and testing to understand the root cause before recommending treatment options. A persistent dry cough can be a sign of something more serious when you start experiencing other symptoms. Chronic lung diseases like IPF, lung cancer, and heart failure can worsen quickly if left untreated. You should see a doctor right away if your dry cough is accompanied by the following symptoms such as shortness of breath, high or prolonged fever, coughing up blood or bloody phlegm, weakness or fatigue, appetite loss, chest pain when you're not coughing, night sweats, and worsening leg swelling. Often, it's the combination of one, or more of these symptoms, along with dry cough that can be alarming, but it's important not to jump to conclusions until a full workup has been done. Depending on what other symptoms you have, your doctor may order a number of tests to help diagnose the cause of your dry cough. After conducting a physical exam, your doctor will ask you some questions about your dry cough, like when it started, if you notice any triggers, or if you have any medical illnesses. Some tests your doctor may order include chest X-ray, blood sample, CT scan of your chest, throat swab, phlegm sample, spirometry, and methacholine challenge test. Some of these will help your doctor get a closer look inside your chest, as well, and test your bodily fluids to check for infections or other health issues. Others will test for how well you can breathe. If these still aren't enough to pinpoint an issue, you may be referred to a pulmonologist, a doctor who specializes in lung and respiratory diseases, who may order more tests. A chronic dry cough can pose a threat to your overall health if it's not treated. It can make any current conditions like IPF worse by scarring your lung tissue even more. It can also make your daily life more difficult and cause discomfort and potentially damage. The American Lung Association outlines some risks you may face with a chronic dry cough, such as exhaustion and decreased energy, headaches, nausea, vomiting, chest and muscle aches, sore throat and hoarseness, broken ribs, and incontinence. If the problem is severe, you may even find yourself avoiding social situations, which can lead to anxiety, frustration, and even depression. Persistent dry cough may not always be a sign of something life-threatening, but it can be harmful. As such, it's important to address it quickly. Thank you for watching. Don't forget to subscribe to our channel and like this video.